Hi everybody. So today I am here to share goal number 3 in International Patient Safety Goals. So this is coming around like the safety of high alert medications whenever we use among the patient. So this will be like in all the stages whenever we use medications such as during prescription, transcription, dispensing, administration, labeling and storage policies. And we'll be also coming across of what is look-alike and sound-alike policies and how it is to be handled and what are the narcotic policy and how the concentrated electrolytes are being removed from the patient care unit. What is high alert medications? So the drugs are that bear a heightened risk of causing significant patient harm when they are used and or might be they are causing a critical error to the patient. Then there is a risk of patient safety. So you can keep these high alert medications in a mnemonic such as a pinch drug. A pinch drug. So A pinch drug is nothing but anti-infectives. A for anti-infectives, P for potassium and other electrolytes, I for insulin, N for narcotics and sedatives, and we can use C for cancer, chemotherapy drugs and immunosuppressives, H for heparin or other anticoagulants. So these are the common examples. So anti-infectives, aminoglycosides and amphotericin whenever we are using the patient. See that they can cause, if it is used wrongly, they can cause adverse reaction to the renal as well as to the cochlear, that is ototoxic drugs. And whenever we are going to use potassium, magnesium, calcium and hypertonic normal saline, they can cause severe electrolyte disturbances if there is adverse reactions. And whenever we are going to use soluble insulins, they can also cause adverse reactions such as hypoglycemia. And in case of usage of narcotics or sedatives such as opioids, benzodiazepines or propofol, the patient can go for deep sedation. Some patients can also go for severe respiratory depressions. Cancer chemotherapy and immunosuppressives like eptiocoside, vincristine, methotrexate may cause hematological toxicity. And whenever we are using heparin, see that you're going to use it to the right patient. Heparins, all forms as well as vitamin K and oral forms of heparin such as rivaroxaban, apivaximin, which can cause severe hemorrhage when it is used on a wrong patient. So here I have given certain examples of how a label is being used on an IV line, especially when the patient is receiving high alert drugs. So this yellow color which is indicating like a patient who is on epidural infusion and the black color sticker which is indicating that the patient is receiving chemotherapy drugs. Red color sticker which is indicating that the patient is on heparin drugs and this white with red color indicates that the patient is receiving insulin drugs. And when the patient is receiving a white label with a purple color which indicates that the patient is receiving oxytocin. And again white with deep purple color which shows that Maxulf. White with blue, that is blue shade which indicates narcotics. Orange shade which indicates paralytics, IV nutrition and so on. So each hospital will be having their own policies, but universally what we follow is that all the lookalike drugs will be labeled as yellow and all the sound-alike drugs will be labeled as green and all the non-emergency oncology drugs will be labeled orange. Emergency oncology drugs will be labeled as red. So here these are lookalike drugs. Lookalike means they look the same, but in case of an emergency, we may, if it is very closely placed, there is a chance of error of giving instead of lidocaine, we may use neostigmine. Instead of being administering adrenaline, we may be supplying the patient that is ephedrine. Or instead of starting with ondansetron, which is an antiemetic, we may like misusually use when it is very closely placed when these vials, we may accidentally take this oxytocin and infuse, which is actually a synthetic drug which is done for the induction of labor. So this is how a lookalike drug resembles and it is our duty. So these are some of the other examples. You can see that this is actually ondansetron and you're having metopromide, and here it is hydrolysin hydroxyzine, which is looking the same, glycopyrrolated protamine sulfate. The other that is sound like means you may be whenever we pronounce like dobu, dopa, which is dopamine and dopamine, or might be danctinomycin, daptomycin, hydrolysin, hydroxyzin, nifedipine, nicardipine, nifedipine, nimodipine. So here you can see some of the letters are in caps, which we call it as tall letters. So with this we can identify whether it was like vincristin or vinblastin, like that. So this look-alike or sound-alike drug are all the emergency drugs. Starting from procurement till the administration and assessment, we have to be having a close monitoring and close check to avoid the drug allergies to the patient and adverse drug events. So how we can enhance the safety? So minimize the availability of multiple medicine strength. Might be you're having so many multiple strength for one particular medicine. So we have to immediately minimize that particular thing. Avoid similar package of drugs and avoid similar package of appearance comparing with the existing package of drugs. Whenever we store look-alike or sound-alike drug, use Stallman letters to emphasize whether it is the exact drug which we are looking for. You can also label the look-alike and sound-alike in emergency drugs and chemo drugs with different color codes. Keep it separately from each other so that they are not very close to each other, and keep it under lock and key. Whenever it is necessary, we can remove it and we can use it. And whenever this lookalike drugs are being prescribed, see that the brand name and the generic name is being placed in the prescription dosage form, what type, whether it was a vial or ampule or it is a capsule or it is any other form of inhalation drug, then the dose as well as the indication for usage. Always use Townman letter in the computerized prescribing order entry, which may prevent the error from misentries and then mal entries. Minimize the use of verbal as well as telephonic order. And during dispensing, see that all the medications are having with the name, strength, and not by the appearance or location. Whenever you give to the patient, explain that by double checking and then you dispense. Highlight the changes to the patient when you are dispensing the drug. And even during administration, carefully label each medication before administration. Check the purpose of the medication as well as the dosage. And after administration, just monitor, because some of the new drugs may be released in the formulary. See that whether the patient is having any other adverse reactions. Always monitor who have received the wrong medicine in case of as a result of medication error in look-alike and sound-alike drug. So the last but not the least, information to the healthcare team members. Frequent updation on the drug training must be given to all the healthcare providers, as well as the list of new LASA drugs must be introduced to the each unit. So that's all for today. Thank you all for your patient listening. If you have any doubts or queries relevant to LASA, please give me your suggestions and as well as your feedback on the comments box. Thank you for your support. Please do subscribe and share. Thank you all.